Hello, everyone. Thank you for joining us today, April 20th, for our This is Public Health Graduate School Virtual Mini Fair. My name is Alicia Kuyate. I am the Enrollment Operations Manager at ASPTH, and we're really pleased to present today and share the 7 schools that we have with us. So a little housekeeping, we are going to have a Q&A portion of this event at the end of our presenters. So there is a Q&A box that you're more than welcome to leave questions for the presenters, for me to get to once we get to that portion. There's also a chat that you can also chat in, but I do recommend putting any questions you're going to have in the Q&A box. It's just much easier for us to get to once we get to that portion of the presentation. Since this is a meeting today, because we will have breakout rooms starting at 1 p.m. Eastern Standard Time, you can change the layout here so you can only see the speakers that are actually speaking and presenting at that moment. It helps clean things up a little bit for some people. So I'm going to leave this on the screen for just a few seconds in case you're interested in following the instructions there. And now we get to the very exciting part, which are actual presenters today. These 7 schools have taken their time today and agreed to meet with all of you. So I really think there's going to be some good content for you all, and you'll learn a lot. If not in the first half, then definitely the second half, you get to speak with them directly in our breakout rooms and ask any questions you have about their programs, their application process, or anything else about the institution. So I will now stop sharing, and we can go ahead and get started with Emory University.
Excellent. Thank you so much. Let me get my screen up for y'all. All right, Alicia, can you confirm for me that the right screen is showing?
Looks great.
Great, thank you so much. All right, hi everyone. My name is Emily Lakemaker, and I am the Director of Admissions and Recruitment here at Emory's Rollins School of Public Health. And I'm really happy to be with everyone today. So to get started, just want to cover some of the degrees that we actually offer. You can see we offer the Masters of Public Health, an MSPH, Masters of Science in Public Health, and a PhD program. The main focus of what I'm planning to talk about today is in the MPH and MSPH range, but happy to address any specific PhD program questions you all might have when we're in our breakout sessions. When you apply, you will apply directly to one of our academic programs. You can see here we offer behavioral, social, and health education sciences, biostats and informatics, health and environmental health, epidemiology, health policy and management, and global health. The last program listed there is our executive MPH, and that is designed for working professionals. That is the only program that we offer that is exclusively online. But in order to be eligible for that program, you do have to come in with generally in the 3 to 5 year range of full-time experience, full-time work history, whereas the rest of our programs are a little bit more open. We've got students that come in directly out of undergrad or some that are coming in with work experience as well. Continuing in the what we offer and the different degrees, you can see on the left-hand side of the screen, all of the different dual degree opportunities that we have here within Rollins and Emory. So the way that our dual degree programs work is that you would, your home program would be basically anything that's not the public health one. So whether that's med school, law school, nursing, physical therapy, physician assistant, that's going to be kind of considered your main home program. And then you would take 1 year out of that and spend over at Rollins doing your public health work. So it basically shaves off 1 full year of the degree. So for instance, if you were to do the dual JD, law and public health, the JD program is 3 years. The public health program is normally 2, but instead of it taking 5 years, it would take you just 4. And you would not do these classes concurrently. You would do, two first initial years in the law school, come over to the public health program for 1 year, and then back to finish up with the JD program. And that's how it pretty much works across most of our dual degree programs. If you're not quite as ready to commit to 2 full degrees, but you still want to take some opportunities to really hone in into what your interests are or your research areas that you want to focus on, you can do that through our certificate programs. And you can see here on the right side of the screen the different certificates that we offer. And if you think of applying to the academic department as kind of like your major, you could think of these as a minor. And our students are able to utilize their electives to take classes to fulfill the requirements for the different certificates that we have. So we are located in Atlanta, Georgia. And not only that, we are actually next door to the CDC. So that is a pretty common goal for a lot of our students that we see is wanting to end up working at the CDC. The great part about Atlanta is that there's not only is there the CDC, there's also many other public health agencies and opportunities for our students. But we do have just about 1,200 alumni currently working at the CDC. And what that means for our students is that those opportunities are also there for them while they're in school and earning their degree. And so through one of those programs where you can kind of get some full-time, some real live work experience while going to school, we call it REAL, which is Rollins Earn and Learn. And this is one of our funding opportunities for students. And so if you are awarded REAL as part of your financial aid package, for domestic students, you just need to fill out FAFSA for that. International students get a separate application for us. If you are awarded REAL as part of this, you get the opportunity to apply for jobs that are part of this program. And agencies, companies have partnered with us for this. They pay half of the student salary. We pay the other half. So that's the incentive for them to be part of this program. And students work anywhere between, 15 to up to maybe 19 hours a week in their real position. And the thing that we like to emphasize on this is that they're getting actual real, you're not making coffee, you're not getting copies, you're doing real life public health work while you're, going to school and also being able to earn a little bit of money on the side as well. And so kind of continuing in with that on some ways to finance your degree, in addition to Rollins Earn and Learn, we also offer some mission-driven aid. So if you are a return Peace Corps volunteer or a return AmeriCorps volunteer, we have funding that is awarded to students from that. We also offer merit-based scholarships. Those are competitive. Applications must be received by our priority deadline of January 5th, and that's going to be every year that deadline. So any applications that we receive by then will be automatically considered for those awards. So there's no separate application fee or application that you need to worry about for scholarships when applying. And then students can also obviously fill out our the FAFSA form for different loans or anything that would be available through that. And just keeping in mind that that would be only eligible for domestic students. And then there's also the public loan forgiveness programs, public service loan forgiveness programs for students that might enter that field upon graduation and get some assistance with their student loans. So one of my favorite things about Rollins is our very engaged student life. We have just over at this point 16 student orgs across Rollins. That's not even just Emory, that's just within our graduate public health program. And you can see that we offer a wide variety. We've got Environmental Health Action, Association of Black Public Health Students, our Latina and Latinx Alliance, Students for Social Justice. So regardless of what you're interested in as a student, there's probably some student org that aligns with that. These groups are very active. They have events, public speakers, professional development opportunities, networking opportunities. So there's always something going on. And this is a really great way to get to connect and meet your fellow students who are going to be your peers when you're working professionally in the world of public health. And then this is just a quick snapshot of who our students are, of what our incoming class looked like this past year. You can see average age was about 25. It's a pretty even split on students that are coming in with work experience or coming in directly out of undergrad. So work experience is not a requirement for a majority of our programs. We brought in just over 530 students, and you can see the gender split. That's pretty common across the field of public health, that 80 to 20. Just under half of our students identified as students of color. We had over 30 countries represented, 56 languages spoken, and about a fifth of our students are identifying as international students as well. And you can see our average GPA there is about a 3.56 for our incoming students. And with that, we really don't have a minimum GPA requirement. I just kind of like to give students a sense of what that overall average is. But if you're feeling like you're a little bit weak in one area in your application, then that's
Sorry to interrupt, Emily, but I just want to make sure that we have enough time for the other presenters.
Oh, am I already? I'm sorry. I thought I was right on. But
I know 5 minutes is shorter than you think.
Yes, thank you so much. Well, so that's our class profile, and then this is just our contact information, which I think everybody's going to get a copy of this recording, so everybody should have that. Sorry about that, Alicia.
Next up, we have George Mason.
Hello, everyone. I'm going to share my screen. Okay, so hello, my name is Joelle. I'm from George Mason University's College of Public Health. As of November 1st, we are the first and only College of Public Health in Virginia. We're very excited about it. And a little bit about Mason before I get into our program. So we are Virginia's largest public research university. We are an R1 institution. We were recently named the most diverse university in Virginia, and we are located in Fairfax, Virginia, which is in the Washington, D.C. area. It's about a 20-minute drive from D.C., and we are right by the Vienna Metro stop. These are 5 departments and our various programs within the College of Public Health. The main ones I'll be focusing on today are within our Global and Community Health Department. But if you have questions about the other 4 later, just let me know. So here are our 4 public health programs. We'll have the Public Health PhD. 2 concentrations are going to be in epidemiology and social behavioral science. Our MPH has 7 different concentrations. All of these are in collaboration with the other departments within our college. The first 6 you see on there will be on-campus programs, and the 7th public health practice is completely online. We also have a Master of Science in Global Health and our certificate in Public Health. Okay, so within our Department of Global and Community Health, we do have faculty research expertise in a lot of different areas. Just going to name a few, and the rest you'll see on the screen. We have environmental health, women's health, vulnerable populations, health inequality, nutrition, and substance use. These are going to be the requirements for our public health PhD. It is a 72 credit program. You'll need 8 core courses in research. 7 will be in the concentration of your choice. You have a teaching practicum, qualifying exams after you've finished all your coursework, and then the doctoral dissertation, which will include a proposal in front of the committee, as well as a defense. We get a lot of questions about the difference between the MPH versus the MS. They're both 42 credit programs. The main difference is going to be that in the MPH, you have 7 concentrations to choose from, and they do require a 200-hour supervised practicum, whereas the MS is going to be more research focused. You will be doing a thesis, and in the application process for the MS, you'll need to identify 1 to 2 faculty members whose research you identify with and want to work with during your time in the program. These are priority deadlines. So in the spring, we only offer starts for the certificate. That's November 1st. In the fall, we offer starts for all of our programs. That's going to be the PhD in public health. The deadline's December 1st. For our MPH and certificate, we have a priority deadline of March 1st that will be rolling on a space available basis. And for the MS, the deadline is April 1st, and that is a hard deadline. You can apply to our programs through SOFIS. At the time of application, you will need to pick the concentration that you would like to study. And that applies to the PhD and the MPH. These are application requirements. We'll need transcripts from all schools attended, your statement and goals objectives, your 2 letters of recommendation, your resume, English proficiency exam, if applicable, WES evaluation for foreign transcripts. After your application has been verified by SOFIS, we will send you a supplemental application, and that is the last piece. If you have general questions, feel free to contact our cphgrad@gmu.edu email or come straight to me. It's my name without the O @gmu.edu. And these are our social handles. And next we have Courtney from Louisiana State.
Hi, everyone. The dreaded share screen. Okay. Hi, my name's Courtney Martin, and I'm with the LSU School of Public Health. We're located in New Orleans versus our main campus, which is located in Baton Rouge. And I just want to talk a little bit today about, we all have very similar programs. We offer different things, but I kind of wanted to show off why we're a little bit unique here in New Orleans. My thing will move. Okay, so we are located on the LSU Health Sciences Center campus, and it is essentially a group of the various schools that have to do with health sciences. So we have the School of Medicine, the School of Dentistry, Nursing, etc. And this really allows us to be part of a research-driven collaborative effort to understand health as it is in Louisiana, as it is in the United States, as it is around the world. We are located in the heart of New Orleans. So whenever you see the Superdome, just think of us. We're right there next to it. And it provides us with an opportunity to really look at the public health well-being in a unique atmosphere such as New Orleans. So just a quick look at what we offer. We have a bachelor's program, an MS in biostatistics, MPH in 5 different programs. We have 3 different dual degree programs, and we have 3 different PhD programs. We also offer a wide variety of research opportunities for students who are interested in being involved during their studies. Here I've listed just ones that are located within our school itself, the ones that we house and program. There's also more than 50 that we work with in the city itself, including the Louisiana Department of Health, various research topics, etc. And this is where we kind of get to love the city you're in. It's a common phrase here in New Orleans. We are very focused on how to get out into the community and kind of share public health knowledge, learn that public health knowledge, unique to the city, like a place like New Orleans. And those opportunities are going to be on every level for everyone. Just wanted to highlight something one of our PhD alums said. She chose LSU HSC New Orleans because she loves the city and the people in it. Our school essentially offered her the opportunity to continue her skills, improve her work, but serve her neighbors as well. So a quick look at our students. The average age is 29 and our average GPA is 3.7. As was said before, we do require people to maintain a 3.0 while they're here, though we will consider applicants who may have GPAs that are lower. And this is a look at our race and gender as identified by the students themselves, and a quick look at our diversity statement. It is something we're very proud of here. Our ability to reflect the community we're in is something that we take very important. So these are the various things why you should choose us. CEEP accreditation, we have a 3-to-1 teacher ratio. The GRE is not required for the master's programs, and we have really affordable tuition. We're also happy to announce that we have the LSU School of Public Health Sphere Scholarship, which provides 100% full tuition scholarships to bachelor's and MPH students who qualify. And there's a quick look at who would be eligible for that. A quick look at some of our due dates and things to keep in mind that there's going to be priority deadlines for scholarships. There's going to be different deadlines for US residents and international students. Please make sure to check out our website. It is chock-block full of great information about our various programs. It even has a BuzzFeed style quiz to help you determine which program might be best for you. If you have any questions, make sure to reach out to me and follow us on Facebook and Instagram. We're quite active on those. So the next person who will be sharing is Carol from Mercer University Department of Public Health.
Good afternoon, and thank you. Are you able to see my slides?
I can, and I think you're about to put it in the presenter view.
Yeah.
Perfect.
All right. Thank you. So my name is Carol Morellis. I'm the Assistant Director for Admissions, and I am stepping in for our director today, who unfortunately is under the weather, Dr. Cheryl Gaddis. Mercer University is a private college located in Georgia. The main campus is in Macon, Georgia. Our graduate public health degrees are on the Atlanta campus. We do have a full brick and mortar campus in Atlanta, and I'm responsible for the College of Health Professions, which includes 5 degrees, physician assistant, physical therapy, doctor of psychology, in addition to our public health degrees. And these are contact information for anyone. You can reach out to Dr. Gaddis or any of us in the admissions office. We are located, as I said, on the Atlanta campus. It is a brick and mortar campus in the northeast section of the metro area. You do feel like you're on a college campus. We have about 3,000 students on that campus, including a college of nursing, a college of pharmacy, a business school education. So it is a full campus there, but you also have access to all the opportunities you would receive in a metro area. As I'm speaking to our programs again, we do have a Bachelor of Science, which is located on the Macon campus. And then on the Atlanta campus, we host a Master of Public Health. Also in conjunction, we have dual degrees with our PharmD school, our physician assistant program, our physical therapy program, and our Doctor of Psychology program. In addition, we have now provided a Doctor of Public Health with 2 areas of concentration. One is social epidemiology, and the other is diverse populations and health equity. Some of the requirements for our Masters of Public Health, which there's 2 formats for the Masters. The one can be taken completely online, or the other format, you could take the courses in person in the evenings from 6 to 9, Monday through Thursday. So either format, or you could do a hybrid of those formats also. Many of our students work full-time and then take their courses in the evening for the Masters. We do require a 750-word personal statement, 3 letters of recommendation, one preferably from a previous professor or an advisor. We do look for 30 hours of previous community service, and obviously a bachelor's or BS degree from an accredited university. We do have a minimum of a 2.85 GPA on a 4.0 scale, and the deadline for our application is July 1st to start that fall. We also have the Doctorate of Public Health, which I mentioned. That is a little more stringent requirements. You do need to have a master's from a CEP accredited public health institution or program, CEPH accredited. You need a 3.0 GPA there, and 3 letters of recommendation, and you do need to have worked 1 year minimum in a public health or public service related program. The length of each of our programs, the Masters of Public Health is a 5 consecutive semester program, can be completed in 2 years. That starts in the fall. The Doctor of Public Health is a 2.5 year program, and or 7 consecutive semesters. The Masters of Public Health, as I mentioned, can be taken on campus, online, or a hybrid of that format. The Doctor of Public Health, the social epidemiology, can be taken, the first part of it online, but the second part would have an in-person component, whereas the diverse populations and health equity concentration can be taken completely online. The perspective of our Masters of Public Health is a little different. Our focus is the diverse populations and health equity, and both of our degrees are very practical based, which I'll speak to in just a moment. The cost for our Masters of Public Health program is a little over $41,000 right now. And the cost for our Doctorate of Public Health program is close to $60,000 right now. In our programs, we do not have a lot of opportunities for scholarships. So we do encourage our students to apply for scholarships before they look into their public health graduate programs. Once you're in the program, though, we do have opportunities for graduate assistantships. There are some other scholarships within Mercer and some small grants, but the majority of our students do fund their education or graduate education through federal loans. So as I mentioned, Mercer is a small college in the Atlanta area. We're CEF accredited, which is the Council on Education for Public Health. We have smaller class sizes, 20 to 25 students. We have a lot of interdisciplinary opportunities. The focus, as I mentioned, is very practical based. We want to prepare our students to be ready to protect the public's health and help prevent the spread of diseases. I think I've spoken to all these, and I know we're mindful of our time today. So I'm going to provide the contact information for the master's or the doctorate. You can reach out to any of us. I also like to give tours of our campus. If anyone is ever in the Atlanta area, you can reach out and I'd be glad to do that. So next, we are going to have Rayanne Ralston from SUNY Downstate School of Public Health.
Thank you so much. I'm going to start sharing. Hello, thank you everyone for having me here today. My name is Rayanne Ralston and I'm the Student Recruitment Specialist for the School of Public Health. So I offer application support and kind of help advertise and promote all of our programs at SUNY Downstate. A little bit more about our School of Public Health. SUNY Downstate Medical Center has been around since the early 1800s. We've now evolved into a health sciences university. So we have a College of Medicine, a College of Nursing, a School of Health Professions, and a School of Graduate Studies. And our School of Public Health came around the early 2000s. It is fully accredited by the Council of Education for Public Health Schools. We're located in the heart of New York City, so students really have the benefit of reflecting the communities that we serve. We have our main campus, which you can see that picture here, that's located in the heart of Brooklyn. And then we have an extension site for students who want to study healthcare administration in Midtown Manhattan, so right across from Bryant Street Park, right in the heart of Manhattan as well. Our programs are offered either in person, online, or and students can do the online either synchronously or asynchronously or hybrid for the master's and certificate programs, and our doctoral program is offered as a hybrid program. So it's really designed with working professionals in mind, but we do enjoy a large amount of diversity from our students. Some are coming straight from undergrad. We have a lot of clinicians that are enrolled in our programs, and then we have a lot of students that come from all different academic disciplines. We believe that everyone has a seat at the table in terms of public health. So our curriculum focuses on urban and immigrant health, as well as health equity research. And you can see some of the new facilities that we have. So it really is great for students in terms of solo and group study. These are all of the programs that we offer. We have our Master of Public Health. It is a 42 credit program. You do have to select a primary concentration, but you can rank up to 3 in the in terms of the application process. We have an advanced certificate program, 5 of them. They are 15 credits each. Students can do the advanced certificate in person or online. The rest are offered completely online. The general advanced certificate is a great opportunity for students who may have a GPA below the 3.0 that we're looking for the master's programs. So you can start in our advanced certificate and then transition into the MPH. And then the other 4 advanced certificates are just ideal if you want to strengthen your research skills in the areas that we offer them. We have our Doctorate of Public Health program, which is a 45 credit program that's offered in 3 concentrations. We have our dual degree program that's offered in conjunction with the College of Medicine. So students have to be accepted by both the College of Medicine and School of Public Health to enroll in that program. And then our newest program, which we're accepting students now for the fall, is the Master of Healthcare Administration program. And students can choose to study either at Brooklyn, Manhattan, or synchronous online classes. Our goal of our program is to train the next generation of public health professionals. So for that, we do require field experiences for our master's and doctoral students. And so you can see these are just a short list. We have a database of over 100 different organizations that students work with. They're community-based organizations. Some of them are even located on SUNY Downstate's campus, or clinical departments that students want to work with, or other healthcare organizations or government organizations like the Department of Health. And about 50% of our students that complete the field experience end up being hired full-time by these employers. So it's a great opportunity for our students in terms of career development. In terms of student engagement, our students are active in research, publishing their research in leading journals. They represent us at some of the top premier public health conferences. Our school does sponsor students to go to a lot of these, like the APHA meeting or New York City Epidemiology Forum. Students also participate in student-led organizations. Because we have the Downstate Health Sciences Universities, students participate with students in the other schools, or you have some that are just public health based, like our SPH Student Council that does fun and engaging activities like game nights, but also, professional development, as well as other opportunities as well. Okay, in terms of scholarships, we do have scholarships available. So once students apply to us, they are automatically considered for those. And then tuition and fees, our program is under $20K for our master's and doctoral programs. We are accepting for summer and fall right now. So these are the deadlines. And then this is my contact information if you would like to talk with me more in the breakout room. Thank you. And next up, we'll have University of Miami.
Hi, everyone. Let me go ahead and share my screen. All right, so we are the University of Miami. We're the Department of Public Health Sciences. And so today I'll be talking about some of our program highlights. We offer a Master of Public Health and a Master of Science in Public Health. Those are our 2 most popular programs. But of course, we also offer many other programs. We offer over 15, including several Master of Science, doctoral degrees in biostatistics, epidemiology, and prevention science. And we also offer a few joint degrees, including an MPH and a JD, MPH MD, PhD MD, and we also offer a few certificates as well. Now, for anybody interested in the University of Miami School of Medicine, that is the program that you would apply to first before applying to our MPH program. So I'm going to go over a few reasons why I think the University of Miami is a great school to attend if you're interested in public health. So like I said, we have over 15 master's, joint, and doctoral degrees, and each degree has the flexibility for you to design your curriculum based on what it is that interests you. So we don't require our students to pursue any concentrations, but you are able to group your electives based on different areas of public health that interest you. And we also offer, it's also a requirement to complete a capstone or a thesis project. And throughout that project, you would be able to select a topic that interests you, which may not necessarily be in the electives that we offer. We also engage in more than $324 million in research and sponsored programs annually. So our faculty is always participating in cutting edge research, and they're providing opportunities for our students to assist in that research. So not only is that a great thing to put on your resume, but our students have been able to release their own publications in research because of those opportunities presented by our faculty members. I'd also like to say we're in Miami, so I think Miami is a great location to be in, especially in the winter. We are located on the medical campus. So not only are you in our department, but you are on the hospital campus and you're able to interact with patients, doctors, researchers at all times. And we also offer internship, paid internship and research opportunities for you to engage in aside from the classes that we offer. We also offer scholarship and financial support. So all admitted students are offered a $20,000 department award at the time of acceptance. And then we also offer paid graduate assistant, research assistant, and teaching assistant positions. We are also very proud of the faculty support that we have. So we have over 40 full-time faculty members that are always looking to find ways to engage students, whether it's in their research or outside of the university in different labs that they are working on. And then we also have our Office of Career Services, which we are very proud of, which helps students find internships that may not necessarily be within the UHealth system. And then, like I said, we're on the medical campus and we have a very, very diverse culture. We have many international students, and we actually ranked number 6 on the World Report for Best Medical Schools for Diversity. Some of our department highlights, like I said, we have over 15 programs.
I'm so sorry to interrupt you, but your slides haven't been moving, and I'm sure you have some great pictures of Miami in there if you want to speed through them a little bit.
Let's see. Nice. Let's see what's going on. I am so sorry about that. All right. I think I will just go from here then. I will present this way. So sorry about that, everyone. So like I said, here are a few fast facts about our department. So we are accredited by CEPH. We have over 17 programs to choose from, and we are very
sorry to come back in here, but it's just like a white blank screen.
Well, this is embarrassing.
No worries.
Okay, let's see. Is that working?
Yes. I
Okay,
still see
perfect.
your whole canvas screen, but we can see the slides at least.
Okay, perfect. So I will keep it this way just so everybody has access to the screen. So we have a 3-to-1 student to professor ratio, which we're very proud of, which gives students the ability to really interact and get to know their professors. Also very proud, you may know that we have 22 NCAA Division I championships, Go March Madness and Go UM. We also offer 80+ networking and recruiting events held each year. So we are very big on professional development, and all of our students are required to attend 2 professional development events per semester. But of course, we host them every week. So there's always more than enough opportunities to really engage in the department. And then, like I said, we have a very diverse culture here at the University of Miami, and 24% of our students come from outside of the US. Our application deadlines are coming up. So June 15th is the final deadline if you're interested in the accelerated programs. And then for all other programs that I will mention later on because they weren't on the slides are due July 15. And then if you'd like to get in touch with us and learn some more, you can email us at the publichealthadmissions@miami.edu email. I am always open to meeting with students that are interested in, conducting virtual visits and meeting more of the faculty and staff. And if you're ever in the Miami area, we are also happy to organize an in-person tour so you can really get to know us and get to see the classes and experience it for yourself. And I will just pop back over here really quick for the graduate degrees offered since my slides weren't working. And I will go ahead and I will pass it over to West Virginia University.
Okay, hi everybody. I'm going to tell you a little bit about the WVU School of Public Health. My name is Lauren Devine, and I'm the Director of Admissions and Recruitment for the School of Public Health. My contact email address is there with my colleague Tiffany, who run our enrollment office here, if you would like to reach out to us after this presentation. I'll just tell you briefly about West Virginia University. We're a little bit different than Miami. We are up north, but we are located nestled in the mountains in Morgantown, West Virginia, which lies right on the border of West Virginia and Pennsylvania. We have over 480 student organizations on campus. We are an R1 research university. 82% of the faculty hold the highest degree. We earn the Carnegie Foundation's community engagement classification, which only 6% of universities in the United States have. We have 3 campuses, and then we have 18 sports in the Big 12. The School of Public Health on WVU's campus is located on the Health Sciences campus. We are accredited by the Council for Education of Public Health, and we have 4 main highlights. We are also located very close to a branch of the CDC. We have the health department right in front of our campus. So we're at a really good location for everything going on public health in West Virginia. The degrees that we offer, we have several MS degrees. Our population health degree is fully online, asynchronous. We have Master of Health Administration program, which has both online and residential options. The requirements for admissions do vary between the two. So that would be something I would like to, if you have a question, I can go over in the breakout rooms. We have 3 areas of emphasis within our MPH program. The public health practice and leadership area of emphasis does have an online and an on-resident component as well. And then we have a PhD program as well with 3 areas of emphasis. The MPH, MHA, and PhD programs do use SOFA, so we have a 2-step application process for those. The rest only have 1 step. So if you're interested in those, again, something we could touch on in the breakout rooms. We do require transcripts, West evaluations for international students, 2 to 3 letters of recommendation, personal statement, CV, resume, a TOEFL, IELTS, or Duolingo score for international, and the GRE is not required for any of our programs, including the PhD program. Like I said, some of those have a 2-step process. So you will apply through SOFAs, and then upon your acceptance, you will apply through the supplemental application. And our PhD deadlines for fall were December 15th. The rest are June 15th. So that is approaching fairly quickly. Besides our academic, we're located in Appalachia, so we're a little bit different with what health disparities we're looking at and the different things we're focusing on, but we definitely have a lot of research going on within our school. We have our own career services department within the school who just serves the School of Public Health, so that's something unique to us. We have our Student Association of Public Health, and we do a lot of student activities. WVU is a large school, but School of Public Health is smaller, so we like to focus on the students. A lot of them are very involved in research. We also pay for students to go and present different things. And this year we have our first, we have a MPH workforce tuition project where we are taking some tuition off. So that is something brand new for us, and I can talk about more in the breakout rooms. So I'm going to send it back to Alicia. Thank you all, and I hope to talk to some more of you.
Thank you all so much for sharing your information about your programs, your schools, and your application requirements and all of those. We're going to take some time now to answer some questions that people have submitted. I do see one right now in the Q&A. I want to remind any of our attendees that you're more than welcome to leave some questions for our presenter, and we'll go over them in the next 15 minutes or so before the breakout room. So I'll start with the question that we got in the Q&A box, which is, can I apply directly for master's after graduating from a bachelor's program in Kenya? Or I'm thinking it's nursing. Anyone have any thoughts? Courtney?
Yeah, you can apply. You will have some different requirements, and a lot of it is going to be making sure that you have your transcripts sent through WES, which is the system that essentially translate your grades, your international grades, to a Americanized type system. And then you're also, depending on the country that you're from, just speaking out to a lot of people, at least for us, you will have to meet, either have TOEFL or some other language testing done. Now, for us, if you're from a country where English is an official language, and or your undergraduate studies were done in English, then you're exempt from that process. But overall, same process. Yes, you can apply. You're just going to have a couple of more steps.
Thanks, Courtney. Anyone else have anything to add to that? Alrighty. So we did just get another question. This one is for Joelle, which is, when is the regular deadline for George Mason's MPH program?
So the priority deadline was March 1st. We will be accepting applications through summer on a space available basis. So essentially, SOFIS will shut down. That is when our application shut down, and I believe that's the end of July, start of August.
Yep, I think it's August 3rd this year. Yep. Alrighty. So we did get a question in the chat, which is, are there special arrangements for older students? I'm not sure if this is referencing schedule, but that's kind of where my mind immediately goes with that question. Anyone have any? I know some people mention like synchronous versus asynchronous classes as well. Yeah.
I can respond. I'll respond more broadly. I think it varies by institution what accommodations can be made. So for example, at our school, my oldest student that I recently accepted is 75. So we really have a range. So you do get an academic advisor, which I would assume for most institutions would be the same. So that would be somebody that you can speak with to make sure that you're getting into the right schedule, not, overloading yourself. Some programs are flexible with part-time or full-time. So it's just making sure that the institution that you go to, what accommodations can be made. But some schools or most schools will have like an office of academic support is what we call it. It might be a different name too, which is also somebody that can be an advocate for you if you need additional time, or if you need, any type of help, like with time management or different skills to make you, be successful in a graduate program. So you can also use resources within that as well.
Thank you. That your answer actually reminds me of a question that we got on Tuesday during our mini fair, which is, what are some resources that you all have to support student health and well-being that are available, or especially for online programs? I feel like that's a really big thing for those newer kind of programs. Anyone has a response to that?
We're lucky because we're a really small school. Our intake of students is very small. So the kind of conversations that need to be had about one's mental health, where one is, those are able to happen on a more regular basis. We also provide, the campus itself provides resources such as CAP, which is, the assistance program, the campus assistance program here. But I think the biggest difference for anybody who might be struggling, especially with studies, is going to be making sure that you can make those connections with the faculty, with the staff that are going to be able to help you get through the hard times in that sense. And so I think I could speak for everyone here in that we want to make sure that all of our students are happy, healthy. We're all going to work our butts off to make sure that you guys get through this. Understanding that there's specific challenges on, whether you're a professional coming into a program and doing it part-time. If you're online, there's a lot of unique needs, and we're there to make sure that we can help in any way possible.
Can I just add about the online? So for like our institution, we are like administering a survey when students are accepted so that it talks about your learning needs. So I'm sure different schools, especially with public health, we're big on surveys and data, using informed decisions. So they're able to kind of address your learning needs and then recommend if you should be even in the synchronous online program or asynchronous. So we're even gonna give additional support to the specific online students, making sure that you're still getting the same experience as a campus-based student.
Thank you. Anyone else have anything to add to that? I saw a lot of nods when Courtney was speaking, especially. All right, so we did get another question on the Q&A, which is, how long is a PhD in global health? Is it available online or does it have to be on campus? I know that's gonna vary for some of these different programs. Any PhDs in global health?
I'll jump in for Mason's. You said global health or public health PhD?
Global health.
Okay, global health PhD, not at Mason. Short and sweet.
Yeah. Thanks, Joel. Does anyone have a PhD in global health? All right. A good resource to look for kind of what are some degrees and areas of study is the ASCPH Academic Program Finder. I believe the URL is programfinder.aspph.org. And you can do all sorts of filters. If you want to apply through SOFIS, you can even filter for that specifically. So I would definitely recommend that as a good starting place when you're kind of deciding who has what kind of programs. And that's not just because I work at ASCPH. So I'm going to ask a question that is generally pretty popular, which is, what do you recommend for an applicant to have a very strong statement of purpose? Any quick tips that you can give for that?
I can see for us, I think it's
You're actually breaking
really
up a little bit.
talking about your passion, making sure. Am I good now? Okay.
Yes, much
Cool.
better.
Talking about your passion is really important and why you would make such a great addition to the program. We want to know why you want to be here and what you're going to do in the future. And we want to see people that want to be here instead of, just trying to get another degree. It's who's going to make a real difference and contribution to the public health world.
And kind of piggybacking off of that, remember that the people reading the statements are going to be your future colleagues. And I think it's really important, we talk about why you are excited to do it. They're excited to look for their next collaborator, the person that they're going to be working with. So have a vision as well. Understand where you want to go in some way. It doesn't have to be like, I'm going to be the head of the CDC and by this date. What it needs to be is like, this is how I would like to make a difference. I believe that there's faculty there that can help me do that. I look forward to working with you all.
If I could add one quick thing to Tanvi and Courtney. Yes, definitely passion, definitely how you're going to make a difference. What do you want to do? Where do you want to go? Remembering that your resume for most, if not all programs will be required. That will speak for itself. Same with your recommenders. So just make sure that you're not repeating what's already being said about you and sharing things that only you would know.
That's a good one. And I think also just reading the prompt and even taking notes if you have to, I think those are some very good, important tips for getting your statement of purpose written and sent out. So I do see a question that is work experience required for any of the master's programs presented today? Do any of you guys, I know someone had a public service requirement. I don't know if anyone else has any work requirements.
We didn't have work requirement, but we have 30 hours of community work experience that could be paid or volunteer. So.
For West Virginia's MHA and the MPH area of emphasis in public health practice, the two online options require 2 to 3 years of post-bachelor work experience, but the residential programs for those do not.
And it's pretty similar for Emory's program. Our EMPH, which is executive MPH, our exclusively online program. That one does require in the 3 to 5 years of work experience, where the rest of our programs do not. Some students come in directly out of undergrad, whereas others may come in with a couple of years.
Thank you. And I do see a question that's in the chat asking about if any sort of special academic requirements are going to be required if someone attended a foreign medical graduate school. I know for SOFIS, if you are applying through SOFIS, you will need to get your transcript sent in and verified. We only work with West, which you did mention in the chat, but some schools may also have other accommodations or other programs that can verify your transcripts that they work with. I don't know if anyone has anything to add on to that answer, if that feels pretty good. And I know some people in their presentations also did mention English proficiency as well, and those were those options. Duolingo, IELTS, and TOEFL are the popular ones for that. And of course, we're going to have breakout rooms in just 5 minutes or so you can ask more detailed questions on that if you have any further questions. So I see another question. When applying to the MPH program, can you still apply with low graduate GPA or with low undergrad GPA that doesn't meet the requirements, but you still have a high grad GPA? So if you have a high grad, low undergrad, how does that affect your application? If it does.
You're gonna get the same answer from all of us as well on this one, in that we all use holistic ways of going through the admissions. So typically there isn't one thing that's gonna kick you out of the loop, and there isn't one thing that's gonna make sure that you get through. It is really a collection of who you are based off of these things that we're looking at. So a lot of us are gonna say, like, having a lower GPA doesn't disqualify you immediately. That being said, they are going to be looking for people who they know are going to be able to power through their programs and maintain a certain level while they're in the program itself. So I think what I typically tell people is if they have a little bit lower of an undergrad GPA, include why that's going to be different as part of your purpose statement. And then it goes back to, I have a passion for this project. This is what I would really like to do. Maybe an undergraduate, for the first 2 years, I did what every first 2 years kids do at undergraduate. And I did not realize that would happen. It's not an uncommon story. And so I would say for any of us, it's not a deal breaker.
I think that was very well rounded. Yeah, Rand.
Yeah, just a slight difference. I don't know if other institutions might offer it, but like I was saying, for us, you could start in our certificate program. And then once you have passed those classes, because a lot of the certificate classes are the same foundational classes required for the master's program. And then that's a good way to also show the institution, like Courtney was saying, it's showing that you can handle the work and will do well in the program. So maybe looking into specific institutions that maybe offer a different pathway as well is also a good idea.
That's a great suggestion. Anyone else have anything to add to that? Alrighty. I do see a question in here, and it is wondering, what do global health or community health students feel about their practicum or APE experience? I think that's a pretty interesting question. I know we have a variety of locations with us today too. What are some general feedback you get on the practicums?
I think it's going to vary from student to student, especially what their, area that they're studying is and the experience that they do. But, I think overwhelmingly as a whole, students are, excited that they get to do something that's, real life public health experience while still in school. They're building their network, they're building their skill set, they're getting for our students, mostly they're doing that in that summer between their first and second year. So they're getting a chance to really go ahead and implement what they learned in their first year and getting kind of a sneak peek of some things of what, working professionally full-time in the field of public health would look like. And for some of our students, and I'm sure it's the same for other schools, some students go and do this internationally. So, that adds another element, I think, of excitement to it when you're getting to experience something completely new than what you may normally live around and live through.
And that being said, this is just me being funny, but like we've also had students who go to work for the sewage and water board. So like not all of them are going to look sexy. Like some of them did research on rats. But that being said, it is the experience that they garner and can take into their, future career that is the important element. They're not all. I mean, you get to choose, so it's not like you're being sent to the sewage and
Right.
water board, but like it all depends on where your areas of study and interests are.
And I recommend looking at a lot of institutions will have student stories talking about their practicum experience. So I think that's a good way to get a feel for what students are doing in that institution, in that area, and that might help kind of decide, especially if you kind of know what you're interested in going into and what kind of track you want to follow as well. Well, thank you so much to our presenters. We're going to go to the breakout rooms in just a few minutes, but before we do that, I would like to quickly share some upcoming events that we have with ASCPH. We do have 2 virtual fairs just like this with 7 different presenters that are going to be next week on Tuesday and Thursday. We are also going to have one on May 2nd, and we always have a bunch of events in the fall. So if you want to visit the link on the screen right now, you'll be able to just keep track of us and what we're doing and all the opportunities that you have to talk to different representatives from schools and programs of public health. So without further ado, my colleague Morgan is going to help us out and open the breakout rooms. This is the time where you'll be able to chat with our presenters today, ask specific questions about their program, even maybe if you're going through your application, any kind of little things that you're curious about, and they'll be able to help you out. On the screen are instructions for how to join a breakout room, but if you're having any experiences where it's not letting you in or anything like that, feel free to just type in the chat which room you want to join, and Morgan and I will be able to help you out. Thank you so much for joining us today.